When you're going out in your community, there are large corporations out there, probably in your neighborhood, who have a lot of employees. Oftentimes, those are not your best referral partners. So when you're out there as a Medicare agent trying to determine, okay, I want to grow my business, I want to introduce myself to a referral source, look for companies with a aged demographic.
Hey, before we get into the podcast, really quick, I want to tell you a little bit more about Medicare Masterclass. Medicare Masterclass is a training platform specifically for agents who want to sell more Medicare. And it's built by a Medicare agent named Ashley Van Gundy, who consistently writes over 150 policies per month, even outside of AEP. I'm going to say that again. Over 150 policies per month, even outside of AEP. And she doesn't have a massive team. She just has a really great sales process and her marketing is dialed in. So what does the platform include? Exactly that and much more. You're going to get the 7-step talk path to Medicare sales. So it's going to show you how to increase production. And you're also going to get the lead generation mastery to show you how to dial in your marketing so you can have more leads than minutes in the day. So if you are a Medicare agent and you want to sell more Medicare, this is the best training platform available on the market. Go to MedicareMasterclass.com to enroll today. Let's get back into the podcast. All right. Welcome to the Medicare Masterclass podcast. Today, we have a real treat for you. Someone special and someone that's going to be able to provide a lot of value and even help you in your Medicare business and how you're operating. So we got someone who is what I just found out a couple minutes ago. He's a surfer. He was in politics. He was in Medicare sales, and now he's the president of RetireFlo. We have Dalton Miller. Dalton, how are you?
Oh my goodness, Rob! What an introduction! And I would tell you it's about 66% true. I am not a surfer. I have surfed once in my life. I stood up once, and I was incredibly proud of that. My hope is that when in advance of, I probably not in advance of this AEP, but someday I'll be able to figure out how to get up more than once. But I mean, that was after 3 hours of trying. So surfer is too generous. I appreciate that though.
Yeah, absolutely. I seen it when I was doing a little research right before hopping on here. I'm like, I got to find something unique about this guy. Like, let me do a deep dive here outside of insurance. And I seen surfer. I'm like,
my limited athletic ability, Rob, is what you chose. Thank you. I appreciate that.
Thanks for bringing that out. I'm like, that's the coolest guy ever.
Yeah. Cool. Awesome. Well, let's dive into it. Dalton, tell us a little bit about your background, and then we'll go into the Medicare side and how you got into it. But where is Dalton from, and what's his life like?
Absolutely. And thank you, Ashley. Thank you, Rob, for having me on today. It was so nice to meet you in person just a couple of days ago, Ashley. So I'm thrilled to be on here. But I'm Dalton Miller. I'm from Columbus, Ohio, born and raised. I've lived here all my entire life. So I am, in fact, landlocked. There's no body of water near me. So not a lot of surfing opportunities here. But I went to the Ohio State University. Don't hold it against me. And while I was in college, and even a little bit prior to that, I developed a passion for politics. I was a little grumpy growing up. My dad started a small group health insurance agency, and with the changes that came with the Affordable Care Act, which obviously had a lot of benefits to a lot of people, it's had a little bit of a negative impact on our family business. And I set out to go work in politics and go volunteer and do things. And it led me to the Ohio Attorney General, a gentleman by the name of Mike DeWine, who now most folks know as the governor of Ohio. And I always wanted to work on a campaign, and I reached out to the Attorney General at the time and said, hey, look, let me just drive you around. I'd love to be your assistant. And thankfully, he and his team allowed me to do that. So I traveled with then Attorney General Mike DeWine and served as his personal aide for about 2.5 years, maybe almost 3. I acted as a personal assistant. Many many nights I often stayed in the guest house of his house. The barn is what we called it, where his grandkids stayed, because our day-to-day life was crazy. I've been to all 88 counties with him, and almost every city in Ohio. I've been to the Grape Jamboree, the Blueberry Festival, and it's clear people need to know this about Ohio. There is the Pumpkin Festival, but I would argue more importantly is the Pumpkin Show, which is these are starkly different festivals. And anybody from Ohio would probably know this. The Pumpkin Festival is in Barnesville, but the Pumpkin Show, which draws about like 100,000 people a year,
Wow.
is in Circleville, Ohio. So I've been everywhere. And then we were proud that after a couple years in the campaign, Mike DeWine got elected governor, and I got to serve as a speechwriter in the governor's office for a little while. After that, I wrote a lot of speeches for the governor, and I often joke that my job was he started every speech with my wife, Fran, and I. And so I wrote that down quite a bit, and I drafted a lot of speeches for him. But my dad, simultaneously, like I kind of mentioned before, after the Affordable Care Act had passed, had transitioned his business into a predominantly Medicare business. And his agency is called Seniority Benefit Group, based in Dublin, Ohio, not too far from downtown Columbus. And I left the governor's office to go join him and help grow our family business, Seniority. And now we serve 20,000 seniors with a Medicare Advantage or Medicare Supplement policy, and we've grown quite a bit. We bring on about somewhere between 3,000 to 4,000 clients a year, and we're incredibly proud of that. And as a result, we had to get smart about some of the technology that we instituted in our office. And we're not a traditional Medicare. We're not an FMO. We're probably not even a GA. Folks who are in the industry are going to know these terms. We are an LOA shop. We have 9 writing agents and 3 to 4, depending on the time, client service team members. So pound for pound, we write a lot of business. There are team members on our team who write somewhere between 500 and 700 apps a year.
Wow.
And there's not a lot of time in the day for that. So we have to be slick in the things that we do and how we get to know our clients and how do we manage retention. And so I think we'll probably get into some of those things today, but that's my story. I will tell you, I'm considering moving to California to maybe improve my surfing capabilities, but that remains to be seen. I've got a lot of work to do with RetireFlo.
Yeah, that's why, right before we were on here, you had mentioned that, and I'm like, oh, this is perfect. It's going to tie right into the whole surfing thing.
That's right. And that's what you'll see the theme of our product is you'll see a lot of ocean waves and
right.
We want it to be, I would tell you that, surfing looks easy. That's how we want the Medicare process to be for people. Now, for me, that's not the case, but
That is true though. Like learning how to sell Medicare is a lot like surfing. Like it looks easy when you get up and you're like, yeah, I could go do that. And you get out there and you're like, smack, smack, smack.
Yes.
So, I mean, yeah, any tools that you can like learn how to use to improve your business is just a game changer. So how did you like hearing those numbers, like that's incredible. Like 20,000 members, like, wow. So I am super curious, like how that kind of evolved from like, doing the under 65 to, the Medicare side.
Yeah. And it's an excellent question. We didn't always serve 20,000 seniors. And I want to further qualify that statement by, I know there's some folks who talk about numbers, those are Medicare Advantage or Medicare Supplement policies. We don't even count PDPs in that number. And we've grown to serve that many people, one, because of how we treat our clients. And I think that's what we'll talk about with RetireFlo. But it's been purely relational. We are proud to serve a ton of different, we call referral partners, large corporations, financial advisors, even just community leaders, and we take that very, very, very seriously. The best opportunity to help somebody in the Medicare space at all is often the first time that they make that transition to Medicare. And so we team up with large corporations, even smaller corporations around the state of Ohio and other places, and introduce ourselves and say to their HR director or their benefits manager, "Hi, folks. This Medicare thing's complicated, and you've done a wonderful job of making sure that your employees and your members are taken care of throughout maybe a 30-year time of employment, maybe a 10-year time of employment. Depends on how long that employee has worked there. But when they make that transition to Medicare, that's the first time their health insurance has changed in a very, very long time. And it's their responsibility, not their HR directors anymore. And so it's a very scary time for seniors where they're trying to determine what's going to happen next. How is my health regimen going to be covered? Is my doctor that I've been going to for 15 years still in network? And we help them make that transition. And we almost want to feel like an extension of a large corporation's HR team. So that way it feels warm and fuzzy when they make that transition, and they're not scared or concerned that the things that are important to them are not taken into account. But it's for those folks out there who are trying to grow your business, especially for Medicare agents. This is Medicare Masterclass, and I'm honored to be on here. I don't know if I've been in the industry to long enough to deliver that, but when you're going out in your community, there are large corporations out there, probably in your neighborhood, who have a lot of employees. Oftentimes, those are not your best referral partners. Some of our greatest referral partners are mid-sized businesses who have some more experienced employees who've been there, have maybe an older population who work there. So when you're out there as a Medicare agent trying to determine, okay, I want to grow my business, I want to introduce myself to a referral source, look for companies with an aged demographic, because I often joke we're proud to serve here in Columbus some of the retirees from Wendy's headquarters, which is not too far from our office. Wendy's, the fast food company. We don't serve everybody across the country, but just we've got a lot of employees. But the folks who work at that location. And while we're incredibly proud to serve them, we don't work with that many folks because it's a lot of young people sending out funny tweets for Wendy's, and they do a whole lot more than that. But, we also serve simultaneously an organization called Highlights for Children here in Columbus. I don't know if you've been to a doctor's office. You see that magazine that's always out there, Highlights for Children, especially in pediatric offices. They have some employees who are just a little bit closer to Medicare age, and we've probably served more from them. They're not as big as Wendy's corporate, but we have the opportunity to serve them. And then it's getting to know the financial planners in your community. It's identifying those folks who are getting Medicare questions and introducing yourself. And we're proud to serve almost 300 wealth advisors here in Ohio and in other states as well. And so when those folks come across somebody who's asking them a Medicare question, you have to be top of mind as the agent in their community who knows their stuff, who's going to do a nice job in helping that senior make that transition.
So I guess what is that conversation? I'm sure you guys have kind of mastered what that looks like and how you would maybe communicate that to, a financial advisor on your value, that value proposition. Cause I think that's something that even myself, you have to know, how to convey that to where it makes doing business I want to work with Ashley or I want to work with Dalton. What does that look like for you guys when you communicate that to try to build that relationship?
Yeah, and I'm going to say a CMS dirty word here, but because you're not technically allowed to call yourself an expert, but these folks have to have confidence that you are going to take someone who is very important to them. Oftentimes in a financial planner relationship, that's their client. or maybe even a family member in some cases, and help them make that transition effectively. So when you approach somebody who might be a great referral source for you, you have to inspire confidence in them that you know your stuff, that you know that when somebody like a financial planner who oftentimes means a lot of dollars, a client of a financial planner means a lot of dollars to that wealth manager, that you're going to help them make that transition and make them look good. But even before that step, I think just going out there and letting those folks know that you exist, that I'm here in this community. I'm a local person. I'm not a call center. I'm not somebody who's, I'm going to meet with these people face to face that you send my way. And here are the plans that I'm licensed with, and here's my process. We often use the phrase, try us one time, see what your experience is like. Because once you help their client, their employee, somebody in their community make that transition to Medicare, and then you back communicate with them to say, hey, look, I helped your client, Susie Senior, make that transition, and here are some of the questions that she had. Here is how I was able to help her. That's going to inspire confidence in that person. And now, and like you mentioned this before, Ashley, Medicare, incredibly complicated, and not an easy thing. And a lot of these wealth managers, these HR directors, they don't want to touch it. They want to rely on somebody who knows their stuff. So when that day comes, they hand you off, it's A-okay. And so, for a wealth manager, there are some out there who do that, but who simultaneously do Medicare anyway. But it really takes somebody who is studying this, who's tuned in with what's happening with the market, because there's constantly changes, and we're going to see a whole heck of a lot of changes coming up this AEP, which is something I want to talk about as well.
Yeah, absolutely. And you had mentioned something going through that I want to pinpoint on for those that are listening, is finding people that are getting questions about Medicare. That I think is huge, because a lot of times people are wondering, and agents are wondering, who do I go to build a relationship? Who do I, ask? Where am I networking? And that's a question that you could even write down on a piece of paper and make a list. Who gets questions about Medicare, and make that list.
No, and it's so funny you say that. That's what it takes to write it down on a piece of paper. You could say to yourself, well, I'm going to start thinking about referral sources in my community, and who's getting Medicare questions, who are community leaders who might be bumping into this kind of thing. And you can think about it in your head, but a lot of stuff's going to come up. And you're going to meet with your next senior client, and you're going to forget all about the thoughts that you had. Sometimes, in my recommendation, this was advice I got in politics from somebody I look up to a lot. When I was trying to get my name out there and I wanted that job with Mike DeWine, and this gentleman told me, he said, make a list. He said, make a list of the 100 most influential people in the state of Ohio in politics, and go out and try to introduce yourself and maybe just spend 5 minutes with them. And he goes, you can think about it in your head, but if you don't write it down on paper and you write down all 100, and he goes, that list might not be right that first time you write it down, right. And it probably won't be. But I especially in the Medicare space, if you wrote down 100 names of people that could refer you business out in your community, and then you went out and saw those people, spent 5 minutes with them, 15 minutes with them, just asked for guidance and advice and introduced yourself, your business will be better after having done that than before. I mean, I can't make guarantees, but no brainer,
Guarantees for sure. You'd be crushing it.
Yes, absolutely. And have them just try you out. Well, maybe they say, oh, I work with this call center, or I do X, Y, and Z. Have them just send you one. And then when you get that opportunity, make the most of it. Communicate with that referral source back and say, hey, look, here's how I helped your client or your prospect or your employee. And I guarantee you your business will be in a better place then versus before.
Yeah.
I love
Yeah.
that.
I think that part is crucial as well, is going back to the referral source and letting them know how you helped, because I've gotten a lot of referrals in, a few different industries that I've been in. And my thing was always ask everybody I talked to for a referral, and then ask the referral for a referral, and kind
Yes.
of just keep going from there. But I've never really thought about it in that way, where helping a referral and then going back and saying, hey, this is how I helped this person. They loved it. Who else can I help?
And you said it, Rob. And one thing that I share with my team is, when you're sitting in front of a client, you're also sitting in front of your next three. And if you do a nice job, they're going to tell their family members about you. They're going to tell their friends about you. And one thing I joke about the Medicare beneficiary population is these folks have a lot more time than we do. And that, because they've just retired and they've earned it, and we're happy for them. But oftentimes they sit around with their friends and talk about their transition to Medicare and who helped them. Now,
Yeah.
would Rob and Ashley and I do that? I mean, maybe because we're in the industry, but on our own, I don't know. So if you do a nice job with folks, you maybe even write them a 2-sentence handwritten note after the fact to say, so proud to serve you. Let us know if you have questions. These are small ways. That note cost 75 cents. Just stamp it in a piece of stationery. That's it. And mail it out. And so I just think that you have to be top of mind, because if you're not top of mind, nobody's going to call you for Medicare guidance.
Yeah. Yeah. 100%. 100%. So really just a few minutes ago, you had mentioned that you have team members that do 5 to 900, I think was the range, or 700 to 900.
5 to 700, yeah.
5 to 7. There you go. Sorry.
No, it's okay. It's okay. 900. I mean, I don't know.
Either way,
hey,
it's great. So let's dive into that a little bit. What are them guys doing, and how are they getting that type of reception?
So first of all of those things I just mentioned, that relationship management, these are people in our community who are front of mind, and just naturally on their own, if you search these folks' names, I'll even say some of their names. It's Josh Kinzel, Carrie Quick, Matt Kerr from the Seniority Benefit Group team are absolute rock stars. And if you look them up online, if you Google their name, just naturally, you pull up Nextdoor, our review system, Google reviews. These are people who are getting glowing reviews in our community. So there have been, you almost build this referral snowball for yourself, where there was a time where you were worried about marketing and where your next senior is coming from, where your next client is coming from. You get to a point where you make this transition to, oh my goodness, I have to be a militant calendar manager, so that way I can continue to serve all of these people and fit that in over a short period of time, especially in the annual enrollment period. So these people have built-in systems. They know when they sit in front of Susie Senior, they know they've done the research in advance, first of all, using the system RetireFlo that we're going to talk about here in a second. So they know oftentimes a couple of very good options about what plan they're going to be on. They know when they're going to make that transition. And our agents, and we're very proud of this, and it's not because we don't want to spend the time with these seniors, but we have a lot of one-visit closes because we show up prepared. We know in advance what prescriptions they take and doctors they go to, hospitals, pharmacies. We even get a sign scope, but we're going to talk about that in a second. But then they know how to talk to them, and they're comfortable with that presentation about what that senior's transition to Medicare is going to look like. And then they say, hey, here, and we subdivide our team. And I think this is a key part of why we've been able to grow so much, is we have client service team members that are exclusively focused on Susie Senior after we enroll her in a plan, after that initial discussion happens. And so what it allows our agents to do is focus exclusively on new sales and helping more seniors make that transition to Medicare. So if you're an agent out there, and not everybody can afford that luxury right off the rip, you have to grow your business a little bit, but investing time in building a support team around you that is a known quantity to your clients. That we don't want to ever make a senior feel like, well, I worked with this person and they wrote me and I'm never going to speak to that person again. You have to make that warm and fuzzy transition to say, hey, look, Susie, I helped you. I'm the expert in making that transition to Medicare. This is somebody else in my office who's going to help you answer those complicated questions, because that's a different ball game. Retention is different. What happens every AEP is a whole book's worth of material, and subdividing that out is really important. But those folks who are just getting started, you almost have to wear two hats. So you have to be heavily reliant on systems to, what are my clients seeing? When are they seeing it throughout the year? What important information am I sharing with them about if their ANOC is when it's going to show up, and what that means, when they should be reaching out to me, how this annual enrollment process is going to work. Because one thing about our industry is Joe Namath is going to stir them up. And so they're going to Joe Namath and Medicare Martha and JJ Walker are going to go on and tell every senior in America that there's the grass is greener somewhere else. And and for any senior that happens to be tuning into this, my call to action to them is to rely on a local agent. What we see with those commercials is an incredible amount of fraudulent activity, scams that are happening across America. I usually do an interview with our local news every year about watch out for these scams and rely on a local agent. I have an agency, you can call us and that's great, but rely on a local agent. Don't call those call centers.
Yeah.
Totally agree, because they definitely get bombarded with that. And a lot of the questions that I even get, and I tell them, reach out to me. Like if you see something where you're like, get a phone call, get something in the mail, and it intrigues you, or maybe you're worried or think you need to give them info, call us first. We do all the different, we have all the different plans. We work with the different carriers. We can let you know if it's legitimate. We can explain it to you. We can help you with it if it is a good fit and a good transition. So yeah, definitely have them call you.
That's again why you have to stay front of mind, because they're, these TV commercials talk about the shiny benefit, the mailers, and think they want to attract and generate phone calls from talking about specific shiny benefits. And I think CMS is starting to crack down on some of those things. But oftentimes, your local agent has access to all of the same benefits that they're talking about on the TV screen. So call them, the real person that you know in real life that goes to the restaurant that you go to on Friday night. Don't call, or if you receive a phone call from a stranger, be extra cognizant of that. And I always talk about scams. And, if somebody's on the phone saying that your plan's going to be terminated, that you don't know, and that you need to give them your Medicare number, that is a red flag in your head as a senior. So, we're here for local agent empowerment, not bulk call centers who scam folks. So,
yeah, local agents make the world go round.
Yes.
Those are the ones in the community and making it happen.
That's right.
Do you guys do a lot of events, or?
We do Medicare and muffins. That's our shtick. And I will tell you, I think my dad's been working on a trademark for that. So somebody will have to go find Medicare and martinis or something like that. But I don't know. We'll see. But yeah, we do local events in the community all year long. With kind of an added focus going up to AEP, and we mail out to our T65 list and say, hey, just come and learn about Medicare with us. And, it's a non-sales environment. This is a confusing thing for seniors. And if you can show up to their local library or a local restaurant, or, you have to be careful about providing meals to people. I know that. But, if you can show up somewhere near them put a face to a name, and come across as educated on the subject, we're pretty confident that those folks will choose you to help make that transition.
So are you still doing under 65 health insurance as well too?
Absolutely.
So is it like your pipeline now, is the way you look at it more so?
I would tell you probably less so. I think there was at one point in a time where that was the case. Most of the people that we serve in the ACA market are folks who maybe have a spouse. Maybe Susie Senior is 65, but Bob Senior, her husband, is only 62. We'll help that person with ACA, and that's just from the general desire that we don't want to lose anybody. We want to keep them in the house. But we're growing our ACA market share quite a bit every year. But our focus is Medicare. But I will tell you, we get a phone call probably a day, because we're in our community as the leaders in Medicare. We get questions about ACA, and we never want to lose somebody who asks us a question. For Medicare agents out there, I would describe it as kind of a no-brainer market to also participate in.
Yeah,
I'm wanting to get into it. That's kind of my next goal, is getting into it. It's definitely got some different challenges that Medicare, it's different, but I totally agree. It just makes perfect sense. And I've definitely ran into that where you have someone that's aging in, but they don't want to go onto Medicare because their spouse is going to lose maybe their employer coverage or whatever. So they just wait, where you could help them.
No, 100%. But you're right, Ashley. It's a different business, and different data points matter about your folks. When you're helping somebody make that transition, or enroll in an ACA plan, an individual plan, you have to ask questions like, are you a smoker? Gather their income level, the year of enrollment. There's a consent form now in that industry, similar, mirroring our scope of appointment. And, you have to take into account those factors, and being schooled up on that it's a different ballgame.
Yeah. Did your time in politics and writing speeches and stuff like that, how much translated over to being in this type of industry?
Some, not all. I don't write any more speeches anymore, and I'm thankful for that, because that's hard work.
Right.
But one thing that I will share is, folks who are in Ohio who know him as our governor, Mike DeWine, but even folks who are around the country who don't know him. Mike DeWine, I believe he's 75 years old. And when I was with him, he was right around 70. What I learned in politics was to match Mike DeWine's work ethic. I was 20 years old when I started with him. I celebrated my 21st birthday with him in the car, driving from one event to another. And this man, now the governor, had a work ethic that put me to shame. I was 20 years old. And he was 70, and would wake up before me and go to bed later than me, and would run laps around me every day. And so I try to take that attitude from our business, is that, we have the opportunity to help so many people. 11,000 people in the United States turn 65 every single day. It's an incredible industry to be in, and you got to be tuned in. You got to pay attention. There has to be a major attention to detail in this, and and understanding what's happening in our industry, but also what's happening with Susie Senior, who's sitting right in front of you. And Mike DeWine was an incredibly good listener. And even after days of meeting with 10 people, and we went to the Zucchini Festival or the North Ridgeville Corn Festival, we were at an event late at night, and it's 9:00, and I'm exhausted, and I have to drive him home. And he was listening to the last person who wanted to talk to him. And I don't know if it directly correlates to our industry, but you know, life is short, and if you spend time and take the time to listen to the people that are in front of you, I think you've got a great opportunity to grow your business. And I think that's what people are looking for in any type of business.
Right, 100%. And that was one of your philosophies, right? Life is short.
Life is short.
And, yeah, if something isn't worth doing, don't do it, is what you also said.
That's right.
I have a similar mindset in where I say nothing great comes easy and nothing easy is great. So it's not exactly the same, but similar to where it's like, it's not worth doing,
don't do it. Don't do it.
100%.
No, you're 100% right. Life is short, and we only have so many days. And I find this business to be incredibly rewarding, not only helping seniors but helping agents, and make their lives better. And I joke that life is short because AEP oftentimes, it was always in the fall, oftentimes a beautiful time of year wherever you live, where the trees are changing and it's a beautiful time of the year. For the first couple of years at Seniority, I didn't really see that anymore. I was in the office working, and the little product that we developed in RetireFlo, not so little anymore, helps people get their fall back and enjoy that time of year with their family, and maybe make AEP not quite as miserable of a time period for folks. And I'm proud that people have used our service last AEP and are going to use this service this upcoming AEP, and your days won't be as long, which I'm thrilled about. They'll still be long, but they won't be as terrible as they once were.
I'm excited to try it and get some of my time back. Yes. And especially too, and I think kind of leading into this, I think you were probably going to talk about maybe the Inflation Reduction Act and like how that's going to impact people. But that's my thought. Like, I need this because, I need a tool where I can start, gathering that information now and analyzing it so that I'm prepared to help out all of my clients. I don't want to lose. And these people are going to be looking for resources, for help. And if you don't have the information, how are you going to help them? And like for us, we don't keep, their drugs, the medications that they're taking. We don't have records of that. So this is going to be huge for us to be ready and prepared now. Start getting that.
And that's the attitude that we have to take, is to start to collect this information early. And for those people who are tuning in who don't know about RetireFlo, and
they're like, what are these people talking about?
Yeah. We're brand new, so it's okay. We're an online service. And we're truly at our core is an online survey that an agent can send to a client or prospect in advance of a meeting or advance of AEP. Our survey questions, the font is humongous. It asks one question at a time. It's incredibly easy for Susie Senior to complete. And I don't want to sound disparaging towards seniors when I talk about the font, but if it's not easy, these folks won't do it. And so that's why we have a hyper focus on our user experience. But when Susie Senior answers your 13 questions, the agent gets 3 things. 1, a list of her prescriptions, doctors, hospitals, pharmacies, and plan preferences. On those prescriptions, they're going to get the dosage, the quantity, the frequency, the package, the brand of the generic, and it'll be spelled correctly every time. No more drug lists written on pieces of paper anymore. Taken care of. The second thing they get is they then have achieved permission to contact. Our survey has been approved by CMS, and in the federal government's eyes, when Susie Senior completes your survey, you now have achieved permission to contact her. Lastly, our 13th question on our 13-question survey is a scope of appointment form. And there are a lot of surveys, or not surveys, but there's a lot of products out there that collect scopes of appointment. The reason why it makes sense in our flow is that, let's say you're meeting with Susie next Thursday. You say, hey, Susie, I'm looking forward to meeting with you. I need you to complete this survey by next Tuesday. That's going to give you a compliant 48-hour scope. But more importantly, when in Rome, also collect her prescriptions, her doctors, her hospitals, and her pharmacies well in advance, so you can have 2 whole days to do plan research and show up to your meetings with plan options in hand. But the best thing about RetireFlo is we have no username or password requirement for Susie, no code, no authorization. And so what this allows an agent like Ashley, let's say if you're out there getting ready for AEP, to take retireflo.com/Ashley, her page, and mass distribute it out to all, several thousand of your clients well in advance of AEP. You could start sending it out in July, August, September, in bulk collecting those submissions. So that way when AEP rolls around, you're locked and loaded with the data that you need. And you mentioned this, Ashley, and it's 100% true. There is a PDP storm coming. I've lately have felt like Paul Revere running around town telling people that there is a PDP problem on the way. Okay. And because of the Inflation Reduction Act, what seniors will benefit from is some of their prescription costs will go down. But what will happen as a result is these PDP premiums, especially for those folks who have a Medicare supplement and PDP, will go up because these prescription drug companies are going to have to, or the insurance plans are going to have to make up for that difference somehow. So these PDP premiums are going to increase. There will be seniors out there who had maybe a 50-cent PDP, a $5 PDP, where their premium might jump to $50, $75. And there's going to be a lot of grumpy seniors out there who thought they signed up for one thing and then their premium got increased dramatically. And so if you're going to be out there helping people through that issue, what are the data points that you need? And it's all the things that RetireFlo collects. So we encourage our users to go out, get signed up for this thing, get used to using it with their clients and prospects. So that way when AEP comes around and you're collecting these submissions in bulk, that you're prepared and locked and loaded. I don't mean to, I'm long-winded and I apologize for that, but
no, not at all.
there's an opportunity in front of every Medicare agent that's out there right now. Is a lot of agents are thinking to themselves, oh no, these PDP premiums are going to increase. How do I retain our clients? How do you retain your folks and keep them happy and keep them with you and make sure they don't get poached by a captive agent, or no offense to our captive friends, or whoever out there is trying to steal them. That's a problem and something you should keep your eye on the ball on. But more importantly, with all of these grumpy people out there who are unhappy with their PDP premium, grow them, bring them to you. That's right. And so and introduce yourself and say, hey, look, folks, you might have had an experience like this where you're unhappy. You just got your ANOC and your PDP premium jumped however many percent. I'm local agent Rob. I'm here to help you. And by the way, before we get started, in order for me to do a nice job, I need you to complete this RetireFlo survey so I'm prepared for our meeting. That's the message that I can deliver as much as I can to folks in this industry is get prepared, collect this information that you need in advance, because AEP is only 30 business days? Not even, maybe? Well, yeah, probably
49.
49.
It's 7 weeks. I think it's 49 days, 7 weeks.
Well, how many business days though?
Oh, I work every day.
Ashley, I want to give you your weekends back. So
I think that would be crazy.
Yeah.
All the years I've done this, it's like the one day I take off every year, just because I've never gotten someone to meet with me, is Thanksgiving. I've had someone set an appointment and then cancel.
It'll happen one of these days. Your wish will come true. I don't know if it's a wish or a nightmare, but it'll happen. So but that's the thing is front load this time. This AEP, this annual enrollment period, starts now, and agents who are taking advantage of this opportunity is today, and thankfully. The folks at Medicare Masterclass have a little promo code to get access to RetireFlo for cheaper than the traditional pricing. So for your folks out there who are tuning into this podcast, if you're interested in learning about RetireFlo, you can always schedule a demo with us on our website, but tell us that you heard about it here, and you get access to promo code MM40. So our traditional 40% off. 40% off of our
I
retirement.
didn't even know it was that much. That's awesome.
Yeah. Our traditional service to have a RetireFlo page costs $49.99 a month. But listeners to this podcast get it at 40% off. So only $29.99 a month. And
wow.
$29.99 a month to totally streamline your AEP and go out there and capture all this new business for you. We feel like it's a pretty good deal.
So, yeah, that's huge, because even like the people that, I mean, I feel like a lot more seniors, like I know the tech savvy part, like there is that barrier, but I feel like all the individuals retiring, like anybody that's, 75 and younger have probably been on computers. So, I mean, that's a lot of our demographic. And that's just going to help so much, even for those individuals that maybe can't figure it out, but all the ones that can, like that's a huge amount of our book of business are the people that can.
Yeah, knock them all out. Get them those folks across the finish line early. But that's the thing is we find that over 60% of our submissions on RetireFlo come via a smartphone. And so these seniors are not, I think they would admit it themselves, not a tech savvy group of people as a whole. But if you can make it easy for them, they can do it. And that's what's cool about our service is it's incredibly senior friendly. We've made it as easy as possible. On average, it takes a beneficiary about 8 to 12 minutes to complete our survey. And the ways that you can distribute it as an agent are incredibly simple. You can email it to your clients. You can email it to your clients in bulk. You can text it to your clients, which is, I would tell you, the most popular distribution method for RetireFlo. And then you can post it on social media, include it in your email signature, turn it into a QR code and send it out in a marketing piece, flash it at an educational event. So there's a million different ways that you can get Susie Senior through the RetireFlo door. But the more the merrier, because we don't charge per submission. That $29.99 cost, flat, doesn't increase. And that's in perpetuity. And you can get as many Susie Seniors through that door as you humanly possibly can.
Is it just a link that gets sent out, or let's break it down a little further for those that are watching? What does it exactly look like?
So Rob, if you signed up for RetireFlo, your site is we're going to generate you a website where your survey lives at retireflo.com/Rob. That's it. You get to choose your own URL too. You get to choose if it's, retireflo.com/ McAfee Senior Solutions, or however you want it, whatever you want to name it. And and then how you distribute it is totally up to you. Again, you can text it to folks, but we encourage all of our users to distribute this in a way in multiple mediums. Maybe you have a Calendly where you schedule all of your appointments. There's drip marketing functions in Calendly to remind people 7 days in advance of your meeting. Drop your link in there. Say, hey, folks, can't wait for a meeting in a week. In advance of it, please complete this survey, retireflo.com/Rob. Or, at the end of an educational event, flash a screen up there with a giant QR code and say, look, folks, you can call me, you can email me, I'm available to you. But if you want me to reach out to you with tailor-made plan options, complete this survey.
I love it.
Isn't that cool?
Yeah. So to dive into that part as well, is there anything in specific that when you guys are looking at it from your end, what works best in terms of texting it or emailing it? Like, is there a certain angle to take where it's to find the best fit plans for you, fill this out, or to make sure I'm prepared, fill this out? What should people be saying with the link?
That's the phraseology usually that we see a lot of our folks use. But to be totally honest with you, and I think our listeners will understand this, is the folks who do the best on RetireFlo, who run it up and get a bunch of submissions. Some of our users have submissions in the thousands.
Wow.
We're also brand new. We're only 6 months old. So we hope that number goes even higher. They basically make it a mandatory part of their process. They say, look, Susie, I can't wait to meet with you. Oftentimes Medicare agents services are free, helping them make that guidance. So they'd say, look, Susie, well, doesn't cost $1 to work with me, but I need you to complete the survey in advance for a meeting so I'm compliant and so I'm prepared. And at the end of the day, Susie Senior doesn't want to have 3 appointments to get her across the finish line on a Medicare plan. Our users have way, way more one visit closes because they show up prepared, and they do it in a compliant fashion. So that's where our users who are really kicking butt, they say, look, this is part of the deal.
Yeah.
Yeah. Awesome. I mean, that's a fantastic tool. And it's funny that you were talking about getting your weekends back and limiting the amount of time, because I've done some work in the under 65 market, and you have the open enrollment there as well. And it's just insane. So,
well, I think good transition, because RetireFlo is going to be launching an ACA survey. So asking those questions like, are you a smoker, income level, year of enrollment, we're going to handle that consent form for you. We hope to have that by midsummer. And then we also have a bunch of very cool integrations coming where we're going to be taking the data that we collect on your behalf and allowing you to do some very, very cool things with it. So I can't talk about it just yet, but stay tuned.
Oh, yeah. I'm excited. How does it work too? I was just thinking about this. I get on RetireFlo, I send it out, I get these submissions back, and then next year comes around and the individual needs to update it. Sure. Is that something where you would do a new submission, or would you go in and update their profile? Does the client have access to their drug list once they make it with on the RetireFlo? How does that all kind of look?
No, absolutely. It's a totally fair question, because, and to put my tech hat on, if we're going to take some of the data that Susie shared with us last year and include it in the survey, we have to make sure that's secure. And so that would require us to put a username or a password or some sort of authorization code on our survey, which we don't candidly particularly want to do. We encourage all of our users to make this a part of your process regardless, our existing compliant survey. And the reason why, first of all, it only takes Susie about 8 to 10 minutes to complete the survey. But the reason why you want to ask her for it again every year, especially if she's going to want to review plan options every year, which is not every client,
right, is
although you might feel like you have an accurate snapshot of her drugs from last year, okay, and maybe that's true. Maybe she didn't change a single prescription, or the dosages didn't change, or anything like that, which I would tell you is rare. Maybe she added a specialist. Maybe she moved. Maybe she didn't even move, but she bought a vacation home in Florida, and she wants to make sure a hospital down there is taken into account. For our industry, agents are often guilty until proven innocent in the grievance department, from insurance companies and from, just generally CMS. And we have to ask Susie Senior just to put a little bit in, because we can't go into her house and look at her drug cabinet and see what prescriptions she takes. And so RetireFlo is a fresh snapshot every year that's going to protect you in case that, Susie's health regimen from a year before has changed over time. But also, we have to take into account the scope of appointment form as well. Scopes of appointment only last for a year compliantly, so for 12 months. So just building this into your workflow, saying, look, Susie, I can't wait to help you. If you want to shop your plan every year, all you got to do is answer these 13 questions, and I'll provide you with what you're looking for. And we find that even our users who are agents who used RetireFlo last year for the AP, they're just sending it out again and giving it as an option to people who want to shop their plan. Not necessarily making it a mandatory for all of their clients to complete. You should make it a mandatory part of your process for your prospects to complete. But for your existing clients, give it to them as an option and say, look, me shopping your plan is probably, in most cases, probably doesn't cost that senior any additional dollars. That's the service that we provide as Medicare agents. In some cases, some agents charge for it because they have different systems. But you got to put good in to get good out. And that's what RetireFlo is all about.
All right.
So as an agent, how long do you have access to the information when you, so probably it's still on there though, like moving forward, or like you still can access it, obviously the scope, but can you access like the providers and medications, or is it like a time limit that you can go in and look it up?
In perpetuity on RetireFlo.
Oh,
So
cool. So you just type in, search the person's name, and bam, it pulls up with the scope and whatever other information they filled out.
time stamped with the time that they sent it in. That's
Oh,
100%
wow.
right.
Love it.
Yeah. So we store it.
That's awesome.
Yeah, in perpetuity on RetireFlo, but also you can download it, that secure PDF, print it, keep it at your office, store it on your computer in a secure file, upload it to your CRM. So that way it's in multiple places. But that's what a lot of our users do is they take our PDF and they upload it into their CRM. So that way they've got an extra file, extra copy of it, but we'll always keep it for you.
That's so cool. And a lot of times too, even clients, once they do that, because they did have like that paper that's like, hanging on by a thread, or you're like,
Yes.
Is that a tablet, a capsule, a cream, a liquid, what is it? And they're like, I don't know, or I don't know how many milligrams or whatever. So, I think that's cool too, that you could print it, because you can even, print the page that's just their medication. So like, hey, and here's your updated list for your wallet.
That's right. That's right. And so and that's what a lot of our users do. They keep this stuff on file. They keep it prepared just in case, if a grievance were ever filed against them or something like that. But more so what we see it for is when, Susie calls in next year and, is this still correct? Oh, you added some stuff. Well, I'm going to need you to complete this survey. But the cool thing about RetireFlo is, and I've kind of lost count at this point, but we have unfounded a lot of grievances using our system. So agents will take our PDF report that we provide to them when a grievance was filed against them, and then unfound it using our document.
Are you swatting a fly in
Yeah,
there?
what's going on over there, Rob?
No, the lights turn off if I don't move.
Oh, I was like, wait a minute.
Lights, right? And I joke around with it when I'm on calls with people, video calls, and I'm like, hey, do you have an Apple Watch? You know how the Apple Watch tells you, like, hey, it's time to stand up and move around? That's what these lights are for me. They're like, hey, you got to move around.
Yeah.
But awesome, man. Yeah, RetireFlo is such a great tool, and in today's age, you need every piece of technology possible to really take advantage of the opportunity.
And the world is shifting. Like, if you don't have tech, like, you're going to get left behind as an agent, because I noticed Medicare, for the longest time, it was, a lot of the independent agents weren't embracing the tech side. And now they're realizing if you don't, your book's either going to get drained, or you probably need to sell it, because now it's coming in. And since COVID, I feel like seniors have really jumped on board with tech. Like, I remember doing some Zoom calls and stuff, and I was having tech issues. I'm not the best at tech either. And I get on there and I have all these seniors sitting ready to go. Like, they had it all figured out, and I'm over here having issues, but they're like waiting there for me. Like, when's this lady going to show up on here all early? And they figured out, QR codes and Zoom and everything, and smartphones. They all have them. They all send texts. They all share videos and pictures and have social media. And so they really do know. They got it figured out for the most part. So you got to embrace it for sure.
No, I couldn't agree with you more. I mean, you're 100% right when you say that you will get left behind as an agent if you don't embrace the technology that fits your agency. And you can put it like this: if there's two agents in a small community and there's one Susie Senior, there's one agent who asks Susie to read off levothyroxine over the phone, and then there's another agent who sends Susie RetireFlo. Which agent is she going to work with? And it's the one who makes this process easy for her. But that goes beyond. There's a ton of amazing emerging tools in our industry. You guys actually recently interviewed a friend of mine, Evan McGuffey, about
Yeah.
MetaZoos. He's awesome, and and what MetaZoos does is fantastic. And so there are a lot of tools out there, especially when combined, are deadly. And
Right.
I look at our two systems, and I'm not a paid spokesman for Evan. I don't get any skid off that. I just think that for somebody who uses RetireFlo and for somebody who uses MetaZoos, you're going to retain your people.
We signed up for that, and our first month running it, we had, and our book of business is about like 5,000 people, and so we had 20 people pop up, and anybody that knows renewals and things like that, I mean, that's really the name of the game, is keeping clients. And to know that I could have potentially lost 20 people, and part of it too was Medicaid. We had quite a few members that had lost Medicaid, and it actually triggered that because, they had to make a plan change. And so we were able to get in front of that, and it helped us retain the first person we called. We saved it. And so,
well, and Ashley, I would tell you that when you went to go save those people, and help them, identify a plan that keeps them with you, what are the things that you need to know about them? And it's the things that RetireFlo collects. So like kind of a 1-2 punch there. You're going to have to scope those people, and so, we're excited. And I think they're and I don't want to make it sound like because I was talking about MetaZoos that this is happening, but we have some very, very cool integrations that are coming this in advance of this annual enrollment period. So watch out for RetireFlo. Use the heck out of us, because it's just going to make you more compliant and more prepared for your meetings. And the listeners of this podcast today, promo code MM40, all caps, $29.99, deal of a century, in my opinion. So I don't want to put work on Rob, but I was like, flash it up on the screen. But anyways,
yeah, we can make it happen.
I've been watching American Idol, so I'm like,
yeah. Oh my God. Yeah. Call in Ruben Studdard,
Yeah.
That's my
my gosh, that was so long ago.
I know. So
awesome.
But yeah, I so appreciate you guys having me on, and I hope that some of the folks who've tuned in here today, have better falls, better AEPs because of our service, and taking these things seriously, because the preparation you do today is how good your AEP will be in the fall.
Right.
100%.
Yep, absolutely.
This was so much valuable information. Like, this is probably one of my favorite, if not my favorite one that we've done.
Good. Oh, I'm gonna text Evan right now and tell
I
don't know. No, it was so great to meet you, and I'm in between Vegas visits right now. I was just at Medicarians. I'm headed to Medicare Con in a few days. I don't know.
We're gonna be there.
Okay, cool. So, and I bet this will probably come after that, or maybe, I don't know. But
yeah, probably.
Yeah, but we'll be post Vegas twice. So give Ashley and Rob a free second, because they'll be have some jet lag from travels. But I'm sure the messages getting ready for AEP will come soon.
Yeah, absolutely. Cool. Well, it was a pleasure, Dalton. Thank you so much for coming on here. And just to recap, there was a few other things on top of RetireFlo that you'd mentioned that for new agents and tenured agents that may be struggling is find people in your community that are getting questions about Medicare. I don't want to let that go down the pipeline and people not remember that. And then when you do get referrals from them, let the referral source know how that experience went. And if you tie in RetireFlo with what you're doing, I mean, it's going to work. So, cool. Well, thank you so much, man. This was awesome.
Ashley, Rob, thank you so much for having me, and I'll see you guys in Vegas in a couple days.
All right.
Yes, thank you.
Sounds good. Really quick, I want to tell you a little bit more about Medicare Masterclass. Medicare Masterclass is a training platform specifically for agents who want to sell more Medicare. and it's built by a Medicare agent named Ashley Van Gundy, who consistently writes over 150 policies per month, even outside of AEP. I'm going to say that again. Over 150 policies per month, even outside of AEP. And she doesn't have a massive team. She just has a really great sales process, and her marketing is dialed in. So what does the platform include? Exactly that and much more. You're going to get the 7-step talk path to Medicare sales. So it's going to show you how to increase production. Then you're also going to get the lead generation mastery to show you how to dial in your marketing so you can have more leads than minutes in the day. So if you are a Medicare agent and you want to sell more Medicare, this is the best training platform available on the market. Go to MedicareMasterclass.com to enroll today.